All right, folks, check this out. A top doctor is now out with a bombshell claim about Donald Trump. He believes that Trump had a stroke around 6 months ago. And in this opinion piece he just published, he goes through all of the different pieces of evidence that we have that is publicly available. Some of it is coming from Donald Trump himself. And when you're thinking about Donald Trump's health, we've spoken about it quite frequently on the show. When you're thinking about his health, there are some really concerning things, whether it be the cognitive decline he's very clearly experiencing, the many different cognitive exams he's been given by doctors. He says he's had at least 3 in under a year, which is not a good sign. The bruising on his hands, the swollen ankle, the MRI exam that later he said was actually a CAT scan. It's all very strange. And so this doctor really goes into it deep. And I want to show you what he has to say. Before we do any of that, make sure to subscribe to the show down below, drop a like on the video, comment, let me know what you think about it. If you're on Spotify or Apple, make sure to follow along and rate the show 5 stars. It goes an incredibly long way. But I just want to start here with some of the most recent pictures we got at Davos the other day of Donald Trump's bruised hand. You might have seen this photo, but that's a bruise on the other hand. Normally, Donald Trump's right hand is the one that he's covering up with makeup and that is quite frequently bruised. This is his left hand, and that's a nasty bruise. That's some serious stuff right there. That's not coming from just a bump. Oh God, that's nasty. It really is tough. And you can see it on his hand. They didn't even try to cover it up. And also just look at the difference in his face color versus his hand color. Looking very orange, but I digress. Not the point of what we're talking about here. The bruise is there, and the White House tried to claim that the bruise came from him knocking on the side of a table somewhere. He knocked on the side of a table and bruised his hand. I'm not buying it for a second. That is a pretty nasty bruise to be getting from just knocking on a table. And if it did come from him knocking it on a table, then he's much more fragile than I think we previously knew. And this is also Dr. Jonathan Reiner, former cardiologist for Republican VP Dick Cheney, responding to this bruise on his hand, saying, why would you continue to take a higher dose of aspirin than your doctor recommends if you're bruising excessively? Makes no sense. He also responded to Donald Trump's insane letter to the Prime Minister of Norway the other day, saying this letter and the fact that the president directed that it be distributed to other European countries should trigger a bipartisan congressional inquiry into presidential fitness. And that brings us to what Dr. Bruce Davidson is saying in this opinion piece and during a podcast he did with the Daily Beast. So we're going to start with him on the podcast, and you'll get a little taste of what he's saying, and then we'll go into the broader article.
Okay, now, can you tell from looking at the president that he might have had a stroke? And I appreciate you can't diagnose him directly, he's not your patient, but you've got years of experience of doing this. And I'm curious if there are symptoms you see physically that might indicate he's had a stroke.
Sure. Well, let me just take a moment to give you some background. Mm-hmm. So I became a American board certified internal medicine specialist in 1981, in pulmonary in 1983, and critical care for 30 years. And when we see patients in the hospital or in clinic, even if we're seeing them for lung problems, we look at their drugs, we look at their past history. We see many patients who've had previous strokes, and we know what that looks like. For President Trump, earlier in the year, there was video of him shuffling, and I thought that was weird. Then I saw him cradling his right hand in his left, which is a common involuntary thing that people with strokes have done when they have weakness on one side. He garbled words much more so a couple months ago than he's doing now.
Everyone loves something at McDonald's. There's always something to have. I like the fish. I like it.
That implicates Broca's speech area, which is in the frontal left portion of the brain. So left portion, and then recently there was video of him walking down the stairs from Air Force One, holding the banister with his left hand, yet he's right-handed, signs with his right hand. So that suggested to me, and his speech became much better, and that suggested to me, along with the 325 milligram of aspirin, for which you only take for one thing, He's had a prior stroke. He's recovered from the stroke. So I think, again, based on what I'm observing, that he's suffering two kinds of complications from stroke.
That's fascinating. And it's a really interesting, he's really picking up on the small things from Donald Trump. And when, they're never transparent about his health, it's really all you can do. You can pick up on the small things, you can evaluate them and whatnot. But it's fascinating to hear from a medical expert's opinion. I'm not a doctor, certainly not a doctor. So getting the advice of them is fascinating. Doctors are trained that absent patient consent, the patient's physician will not and should not disclose patient health information, but physicians can use our training to support patients and the public interest. To the trained, careful observer, it is evident that Donald Trump had a stroke, most likely at least 6 months ago. What we can see is that Trump, who is right-handed, has carefully descended the stairs on Air Force One, holding the banister with his left hand. And that's something that he's been doing much more often recently. This is a separate photo than was shown in the podcast episode, and he was doing it there as well. And he's also kind of like stumbled down the stairs recently as well. Earlier this year, he openly shuffled his feet. He has used two hands to hold a drink. He sometimes cradles his right hand in his left. He has some right-sided weakness without paralysis. And here's a different analysis of the different things that are going wrong with Donald Trump. This suggests a stroke and that the infarction was on his left side. He garbles his words a bit and did so worse earlier, implicating Broca's area, the left frontal brain region that's critical to speech function, as damaged. Trump has quite noticeable repeated excessive daytime sleepiness. Yeah. I mean, we see him fall asleep all the time, likely from post-stroke sleep disturbance, a common residual effect of stroke. Moreover, we know from Trump's own words that he is swallowing a full aspirin pill every day to thin his blood. Although a prominent physician has stated this is too much aspirin, the physician is wrong when it comes to stroke patients, and Trump is correct. The American Heart Association stroke guidelines recommended a full aspirin pill to prevent recurrent stroke after a stroke. That's fascinating. So for a normal person, you should absolutely not be taking that much aspirin. For a stroke patient, it's, I guess, recommended by the American Heart Association. They're saying this is the way. This is how you prevent a recurrent stroke. And Donald Trump is on that exact regimen. It is not recommended for primary stroke prevention, heart disease, arterial disease, venous insufficiency, or other venous disease, only for large intracranial vessel partial occlusion after a stroke. Maybe I could be a doctor. Look at these words. Regarding what the White House reports, Trump had an MRI, which was then changed to a CT scan of the chest and abdomen, which we're told had fine results, but an MRI is not for examining the chest or abdomen. We use CT scans for that. MRIs are used for bony structures like the spine and joints, particularly to provide detail of the brain. People don't make a mistake, a noisy 20-minute MRI and noise-suppressing earmuffs for a 6-minute CT of the chest and abdomen. I mean, they're two totally different scans, and Donald Trump went from it's an MRI to it's a CT scan. If the chest CT was truly fine, it means there was little calcium seen, implying minimal atherosclerosis in Trump's aorta or heart arteries. So the full 325 milligram aspirin tablet is not for the heart. We use multiple different drugs for that. So it's an interesting theory. Of course, there is absolutely no way to tell. We will never get transparency from the White House on Donald Trump's health. When he's had physicals or exams with doctors, he said that he's going to release all the documents, the full unredacted documents, and then never does. And so, again, we're kind of just using our best guess. We are, doctors are, I should say, using the small pieces of information they have, Donald Trump's own admissions, him in public and things like that, to put together a picture for us. And it's not a pretty one, put it that way. So anyway, I will leave the video there. I'm always fascinated by these doctors who talk about Donald Trump's health because obviously they are covering up something. But thank you so much for being here. Make sure to subscribe down below or rate the show 5 stars wherever you're watching it. Drop a like on the video, comment, let me know what you think about this story and what you think about Donald Trump's health. If you think he's right, if he's wrong, if you're indifferent. But I appreciate you so much. Have an amazing rest of your day. We will talk soon.